This meeting is now being recorded.
Welcome everyone, this is Ashley Klein-Jimenez from PreventConnect. You're joining us for our peer learning forum titled Implementing Community Level Strategies to Prevent Sexual and Domestic Violence. PreventConnect is a national program of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. Today we're really planning to draw on CDC's recent technical packages for sexual violence and intimate partner violence prevention to increase our understanding of what community-level strategies might look like. And we also have some DELTA FOCUS and RPE grantees who are going to share their community-level prevention efforts. Finally, we really encourage you all to share your wisdom, tools that have been helpful, resources that you're aware of, and also where you'd like this conversation to go in the future. So these are our wonderful presenters who you are going to be hearing from today. We have Dr. Linda Dahlberg from CDC joining us today, Linda Wilk from a local program, Hands of Hope. We have Sierra Olivia Thomas-Williams from the Indiana Coalition Against Domestic Violence, and finally Melanie Austin from another local program in Kansas, MOCSA, or Metropolitan Organization to Counter Sexual Assault. And we'll be hearing from all of these presenters shortly. In fact, I am going to pass it over to Dr. Linda Dahlberg. And Linda, the Stop Sexual Violence, the Stop SVD technical package and the Preventing Intimate Partner Violence technical package both highlight community-level strategies. Can you talk us through what is meant by community-level strategies? And I'm going to go ahead and give you the podium.
I'd love to. So yeah, I'm going to just get us started today. I'd like to just start a little bit by providing some background on community-level strategies. Essentially, what do we mean by a community-level strategy? How is it different from a community-based strategy? And then I'm going to use, as Ashley just mentioned, some of the examples from our Stop SV and our IPV technical packages to illustrate those things. So I'm going to start with the sociological model, and I know that many people are familiar with this model. It was introduced way back in the 1970s, maybe before some of you were born, I don't know, to address child maltreatment, and then subsequently to address youth violence, IPV, SV, and elder abuse. And I just wanted to mention that there are different variations of this model. The one that you see here is the one from the World Report on Violence and Health, and it's the one that we at CDC started using in our work around 2004. And I think the model is useful for conveying, several points. The first, we often say that, no single factor explains, why some individuals behave violently toward others, or why, violence is prevalent in some communities than in others. What we do know is that violence is the product of a complex interaction between person and context. And it's not really person alone, and it's not context alone. And this interaction between person and context plays out at multiple levels of the socio-ecological model. This slide, I hope you all can see, includes some examples of contributing factors related to the perpetration of violence by these levels of influence. So what you see from individual factors like a young age, heavy drinking, a prior history of aggressive behavior or witnessing, experiencing violence as a child, to proximal relationships, that would be with partners, peers, family, and others, and how those relationships influence the risk for violence, as well as community and societal level influences. At the community level, what we're really talking about here are the settings people move through: neighborhoods, schools, campuses, workplaces, and other organizational settings, and specifically about the characteristics of these settings that increase the risk for or protect people from violence. This would include, for example, like high rates of unemployment, concentrated poverty, residential instability, people moving in and out, of neighborhoods, socially disorganized neighborhoods, which contributes to something we call low collective efficacy, or that willingness to intervene. It would include high levels of community violence, excessive availability of alcohol, poor neighborhood support and cohesion, and weak institutional support. In schools and workplaces, it would include like a lack of attention to safety and security, weak rules and policies, including the weak implementation or enforcement, or lax enforcement. And even just to say that even certain policies and practices themselves, for example, suspension, expulsion, hiring, and firing, those can be harmful depending on how those particular policies are handled. So when we're talking about prevention at this level, we're talking about modifying the characteristics of these settings to reduce these risks or buffer against them. This is what sets a community-level strategy apart from a community-based strategy. Community-level strategies address these setting characteristics. They get at those underlying conditions that increase or buffer against risk. So it's not so much where things take place or even the scale of activities. It's about modifying these characteristics. So what are some examples of that? It would include housing policies. Those might be used to reduce residential instability, concentrated poverty, and community rates of violence. It could be alcohol policies related to pricing, density of outlets, beverage size. I'm not a beer drinker, but I know there's these, beverage cans that hold probably like 2 or 3 beers in one can, so beverage size. Policies to address unemployment and improve the economic stability of neighborhoods. It also includes modifications to the physical and social environment. And that would be like, say, through, greening and other initiatives to sort of bring people together, enhance connectedness, and really sort of create, safe spaces where people live, where they work, go to school, and where they play. And then, of course, policies and procedures in schools, workplaces, and organizational settings. So over the last year and a half, we've been very busy here at CDC, and we've released 5 technical packages to prevent violence in its various forms. And all of these packages include strategies to address these community-level risks. This slide shows, the STOP SV. It features the 5 strategies in the STOP SV technical package to prevent sexual violence. And as you can see, one of those is specifically focused on creating protective environments. The IPV technical package features 6 strategies to prevent partner violence. And it also includes one strategy specifically focused on creating protective environments. So both packages address modifying the physical and social environment of neighborhoods and community settings. And one of those ways is through, as I mentioned, alcohol policies. And many of you may be familiar with the evidence, but what we basically know is that higher alcohol prices are related to lower rates of sexual violence victimization. But outlet density, on the other hand, is linked to higher rates of SV. And outlet density has also been consistently linked to higher rates of IPV. So one of the studies that is described in the IPV technical package is that it's a population survey of U.S. couples, and what they found is that an increase of 10 alcohol outlets for every 10,000 people was associated with a 34% increase in male-to-female partner violence. So it stands to reason that policies that work to reduce a community's outlet density are just one example of an approach that might reduce rates. We have evidence to believe that it might reduce rates of IPV and SV. The evidence suggests that greening urban spaces may also be an effective approach. And there's another study that's described in the IPV package that found that residents of an urban public housing development who were randomly assigned to buildings in proximity to green conditions, like trees and grass, they reported significantly lower rates of partner violence in the past year than residents who were living very close to barren conditions. And one of the things the researchers found was that the levels of mental fatigue, inattentiveness, irritability, impulsivity, those were significantly higher in buildings next to barren areas. And that aggression accompanied that mental fatigue. So research has also shown that green space in urban communities, it's been linked to higher levels of neighborhood collective efficacy and reductions in youth violence, reductions in violent crime, which are both important, all of those important factors for IPV and SV. Modifying the physical and social environment, school environments, that's, if you take a step back, that's another influential context that can be changed or adapted. And it can be changed or adapted in ways that enhance safety, that promote healthy relationships and respectful boundaries, and just generally reduce tolerance for harassment and violence. In both of these packages, they talk about the shifting boundaries building level component. And for those of you who may not be familiar with shifting boundaries, particularly the building level component of that intervention, it really is designed to improve safety in schools by first increasing staff presence in hotspots. And that would be like the areas of buildings that are designated by students and staff as unsafe. It could be, near bathrooms. It could be certain hallways. It also included school protocols for identifying, responding to dating violence and sexual harassment. I had a component around promoting awareness and reporting to school personnel through a school-based poster campaign. And then they also used temporary building-based restraining orders to reinforce respectful boundaries between victims and perpetrators. So this particular program and this building level component in particular was evaluated, the whole program was evaluated in New York City middle schools. And what they found is that the building level component, it reduced peer sexual violence perpetration by 40%. It reduced sexual harassment perpetration by 34%. It reduced sexual harassment victimization, and it also reduced sexual violence victimization in a dating relationship by 50%. So it's pretty impressive results from that particular program. So improving workplace and organizational settings, as I mentioned, that's another very important setting to address. And here, it's really about creating healthy organizational climates to reduce tolerance for harassment and violence. And that includes setting expectations for managers and employees by creating, strengthening, and enforcing policies, enhancing training, education around these policies so that everyone really knows about them, knows how they're to be implemented, follows them, and also offering workplace supports, and just, again, reducing this tolerance for harassment and for violence. So the sexual violence package talks particularly about sexual harassment prevention policies and specifically about proactive sexual harassment prevention policies. And when we say a proactive policy, it includes commitment from top management, a zero tolerance, a notification to applicants and all new hires of harassment-free environments, training and education around that. And the study one of the studies that's described in the SV package, found that proactive policies compared to just information only were associated with fewer incidents of sexual harassment in the workplace. The IPV package describes this IPV and workplace training. It's just another example with some evidence for improving workplace climate towards IPV. This one was tested in county government organizations. And apart from demonstrating some support for IPV survivors, the program was also associated with an increase in the development and posting of IPV policies. So it was like a more proactive action in the workplace around these policies, and then also, importantly, IPV-related resources for employees. The program or training hasn't been tested on IPV outcomes specifically, but the findings are encouraging because they may translate just into increases within the workplace of tangible help and social support, and both of those things have been found to be protective factors for victimization and perpetration of IPV. And the last one that I think is really kind of an interesting one is the Air Force program. You know, the Air Force has been, they've been working with CDC for many, many years now, and they've been, I'd say, just a much more, they're a proactive branch of the military in terms of prevention. And one of the very first areas that's gotten a lot of attention over the years was their work around suicide. They developed this program to reduce stigma and social norms that discourage help-seeking among U.S. Air Force personnel to prevent suicide. A lot of military, you know, uncomfortable or afraid to come forward and express that they might need support. So what they did is they had 11 different prevention components that were put into practice within the Air Force to enhance education and training, and they created policies aimed at promoting help-seeking. And one of the things about this particular initiative is that not only did it demonstrate impacts on suicide, but it also demonstrated impacts on homicide and accidental death. And in a longitudinal evaluation of the program, it showed a 30% reduction in moderate family violence and a 54% reduction in severe family violence following the implementation of the program. So those are just some examples that are in the technical packages around, you know, creating protective environments and neighborhood environments, school environments, and workplace environments. You know, and just to go back to the socio-ecological model, you know, as that model reflects, it's very important to consider, you know, the multiple influences on behavior and do something about them. So creating protective environments is a fundamental part of prevention. It gets at modifying the characteristics of settings, whether they're physical, social, economic, or cultural, to reduce risks and enhance the factors that buffer against these risks. And one of the reasons why this level is particularly important is that it is a critical piece for achieving population-level impacts, and a very nice complement to other strategies. And I will stop there. Thank you.
Thank you. Thank you so much, Linda, for providing that overview of ways that, you know, we might change different types of settings that people move through to promote safety, and for giving us some snapshots of what the research is telling us. I'm going to move to our first text chat question. There is a conversation happening already, which is great. But here's a question for you all. What does creating protective environments look like in the work you are doing to prevent sexual and domestic violence? And while folks think about that and hopefully give some examples, Linda, we did have a question from an audience member, Danielle, in regards to alcohol density. Danielle said, is this specifically talking about retail outlets or also taking bars and clubs and pricing into account? And is this just for intimate partner violence or also general sexual violence?
So in terms of outlet density, that's there's both. It could include the retail establishments, but it could also be bars. Alcohol policy in general would get at pricing. That I think was more so in terms of the sale of beverages, and that could be also in bars as well as outlets. We typically think of it more, or the way it's been tested more, in terms of the retail side of it. But there's a lot that can be done, you know, in terms of alcohol policy, and it's one of those areas that there's potential impacts not only on SV and IPV, but also other forms of violence like youth violence, elder abuse, child maltreatment.
Great. Thank you so much for helping to answer that. So I'm seeing that folks are starting to answer this question. So thank you all. We'd love to hear what this means to you, what creating protective environments means to you, and what that looks like in the work that you're doing. I am going to go ahead and introduce our next guest, Linda Wilk, Director of a local agency in Indiana, Hands of Hope. And Linda's going to share an example from DELTA Focus that is working to create safe, stable, and nurturing environments to prevent violence. And specifically, this example is working to rehabilitate a neighborhood park. So Linda, can you walk us through what the work that you all are doing looks like?
Sure, I'd be happy to. And you kind of, talked about what we're doing, so I'm going to slide right past that first and just get into, this is where I live. So obviously this isn't my whole neighborhood, but this is an area that shows that there's need for improvement in our area, and it's something that I have really been passionate about, making our neighborhood improved. And it's also something I've really been fascinated with, the theory of the broken windows, which is a criminological theory of the norm setting and signaling effect of urban disorder and vandalism on additional crime and antisocial behavior. So as I started to see my neighborhood begin to decline and the park that we're working on declining, I wanted to do something to improve things. And so it was actually at the neighborhood park in August of 2013 that we had a neighborhood picnic, and at that event I met a Taylor University professor who'd just been hired to start working on public health at the local university, which is in Grant County. So the first step was to gather a group of students from Taylor University and do a comprehensive walk and survey through the neighborhood to see what people thought of the area. Our focus was on social cohesion. Our assumption was that neighbors did not know each other and would not have anyone in the neighborhood to turn to in time of crisis. In reality, what we found out is that most neighbors did know someone in the neighborhood that they could turn to for help, but they were concerned about crime and wanted to see an improved quality of life. Specifically, they wanted a reduction in crime, violence, and trash, along with more opportunities for youth. So to work towards improving the quality of life in the neighborhood, I began walking the streets with a couple other neighbors, picking up trash. Then in the fall of 2016, my work focused on working with city officials to support the passage of two ordinances, one focused on trash and the other on leaf pickup. About that same time, a group of Indiana Wesleyan University design students selected our neighborhood association as one of its projects, which in turn refocused my attention on Barnes Park. It was during the focus group that neighbors reported that someone had been driving through the park, which you can see was pretty open at that time, leaving deep ruts in an open area of the park. So we wanted to work to eliminate that potential for drivers to, vandalize the park. And the students put together a conceptual design they created to make improvements to the park, to keep a barrier so that with tires and other vehicles car parts that they thought would really add to the park. Well, the work that they created, the Marion Parks Department wasn't exactly excited about. It at least gave me an opportunity to start the conversation with the Parks Department and what improvements could we make. So this is the next slide, shows you kind of the disarray, the old equipment that we had, the dangerous merry-go-round, which was the first thing that was taken out. So we started to work with different organizations. We got an alternative school that took a half day and repainted the park. The Marion Parks Department then agreed and installed 2 grills, 2 trash cans, along with a park sign and a dog sign with waste bags for pet owners to use. And then they also agreed to donate to us, the Parks Department did, this large playground equipment, which we estimated, or they estimated to be about $30,000. The only catch was that we had to figure out how to move it from that existing park, or non-existing park, to where ours is across town. So I started to work with local volunteers, and on July 15th, they came together and they started taking apart some of the exterior pieces. And the goal was to just leave that base, but then a local contractor was going to come in and take the rest for us. That didn't happen. Instead, a local contractor, his business started to boom, and so I went to the local mayor and said, would you help us, with this? And he agreed to do that. What you see now is also what was at the park, and how, again, local volunteers, we took some of the other equipment. You can see this old, rusty-looking spring toy, and we had 3 of those, and they actually repainted them, refurbished them, and we'll be putting them in the park. Within 24 hours of me having the conversation with the mayor, he agreed to have some of his workers come and take the equipment that was left. So you can see the large excavator, and both the the street department and the local building director decided instead of trying to pull it out, they would cut off the base and then relocated it to the current park. We're still in the process. We haven't gotten it all done, but we're well on our way. We also, in another attempt to improve the park, there's a fence that borders private property on one side, and then the fence is where the new playground equipment will be. Reached out to Indiana Wesleyan University, and as part of their freshman orientation, agreed to paint this side of the privacy fence. The owner said that that was okay, and so now you have a much more beautiful, attractive part in the playground and in the area. The ongoing plans for the park, this past Sunday we brought volunteers back again. We installed 2 repainted benches and started to put the concrete in for the spring toys. Currently you can see that there's soil and dirt along that area where the alleyway was. The plan is we have a local landscaper that's in the process of creating a berm that will have trees and shrubs and wildflowers to make a natural barrier so that people won't drive in the park, but it will be attractive to people wanting to come into the park. At the entrance you can see we have a nice new sign. We have a bike rack. We'll also have, in the next couple of days, donated 2 large boulders so that kids can play on them and yet cars can't drive through there. The next step, my daughter this summer, as part of a 4-H project, built a mini library. So we will add books to the library. That will be in the park to add literacy, the opportunity for children to read, for parents to read to them. The biggest thing for everyone to remember, I think, is as everything that we did, I made sure I was working with the Marion Parks Department Director. I was making sure that everything was low maintenance. We don't want to add additional burdens to the city, to their staff. And then eventually we're hoping to add some additional things such as a splash pad and electricity, reaching out to local funders. This next slide I have decided is our Barnes Park mantra: never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I found that to be very telling as we worked through this project, and as we are working through this project. It was on the Marion City Planning Assistance bulletin board, and I thought that very appropriate for us. The goal is to have the park, the first phase, completed by October 22nd so that I can do a ribbon cutting on that day with the mayor, with all the people that have helped, and celebrate as part of Domestic Violence Awareness Month, which is in October, how we have been hopefully reducing domestic violence. I will say that I have seen more families interact at the park. We're seeing children playing. We're seeing more ownership in the park. People are going there and they're having picnics. They're just sitting, they're playing soccer. What used to be an area that people didn't want to go to, that people were afraid to go to, they're now really inviting, walking their dogs. And so it's been a huge undertaking, but a very encouraging one. As far as key takeaways, words of wisdom, I think it's critical to build relationships before you take on a project of this magnitude. It takes a lot of patience. Relationships and patience are probably my 2 takeaways for this. It's something that can happen, but it won't happen overnight. I think the other thing that's so important to remember, and I try and keep this in the forefront of my mind, what I'm doing, that's my job. That's what I do every day. For everyone else, it's an additional job, an additional task. So I always try and be very thankful, very appreciative of everyone that has helped me, and that very patient. So.
Thank you, Linda. It's really great to hear about the changes that you've already noticed in terms of people getting outside and utilizing the park to recreate and spend time with one another. That's really exciting, and it must feel good to see those things actually happening after all the work that you all have put in.
Absolutely.
So we actually have a question, Linda. Lori has asked, Linda, do you know if there has been any impact on the surrounding neighborhood, and what are other ways you are evaluating this effort?
As far as the surrounding neighborhood, again, that's really where I live. And so a combination of neighbors, being out picking up trash, as well as being in the neighborhood, I've seen more people interacting with each other, which, again, if you're not in isolation, then domestic violence and other crimes are less likely to occur because people are paying more attention. I've seen more conversations between people that otherwise, used to be you just didn't see people out talking as much or in the park enjoying, what's going on. As far as evaluating, a lot of our evaluation has really been talking to the neighbors. What are they saying? Have they seen a reduction in crime? We're working with local police to get the statistics from them. Has there been, what kind of crime calls are we seeing? Are they changing? Are they reducing? So those are the areas we've been kind of focused on.
Great, thank you. And I have a question. I'm just wondering, when you approached that homeowner about painting the other side of the fence, how did that go? Did you have to make a case or?
No, not at all. In fact, he was very happy to do it. He said, he had no problem with that. He has children that play in the park. He was encouraged by what we were doing. He also, I think, found it to be a way that he felt his house might be safer because, before it's always been a park, but it's been a park where drug dealing was taking place and some other things that, he really didn't want. And so now I was surprised. He immediately said, absolutely, not a problem.
That's great. Thank you so much for sharing that. Well, thank you. And if folks have other questions for Linda, please feel free to put them in the text chat, and we will try to get to them at the end. We are going to move over to our next guest, Sierra Olivia Thomas Williams at the Indiana Coalition Against Domestic Violence. And Sierra, I'd love to go to you to hear about some other work that's happening in Indiana to change the physical environment in order to increase social inclusion for community members. So I am going to give you the podium now.
Excellent. And is my mute off? Can you hear me?
It is. We can hear you.
Okay. Way to represent Indiana. Woo! I'm so grateful to be on this peer learning forum among this community. I feel the power or the empowerment coming through my screen. So I just want to say thank you for Ashley and PreventConnect and everybody else for being on this peer learning forum with us. I am so excited to talk about a project that I was involved in from about 2015, started in February 2015 and morphed into something different in January 2017. And I want to let people know that if you want to go to the website where this forum is on, there are two things that I'm going to be talking a lot about in my time, and that's the Sidewalks to Sexual Violence Prevention Project Guide, and specifically the thing that I think is the takeaway for all of us is the Inclusion Appendix, which is a compendium of every assessment tool that we created over the 2 years together, and all of those tools were created collaboratively. And I just want to encourage people to look at them, use them, and please reach out to me because I feel lonely in the prevention world working with disability. So I'm excited to talk about the Bloomington Inclusion Collaborative. We started in Bloomington, Indiana in 2015, and our project was really meant to increase the protective factors of social support and connectedness. And I just want to remind us that connecting the dots says that social support and connectedness are preventative of 6 forms of abuse that span the lifespan. And so it's a really big mammer jammer, as my colleague Colleen would say. And So the risk factor that we sought to reduce was social isolation for individuals with developmental or intellectual disabilities. And as an aside, through this project, we really figured out that direct support providers at disability service agencies were also experiencing many of the same forms of social isolation that individuals with disabilities were. And so we've really focused inward, and that's what we're doing this year in 2017. We are we're trying to reduce perpetration by increasing social inclusion for staff members in disability services agencies. And so just the essence of the collaboration over 2 years, we had 20 to 25 people with a variety of physical, developmental, and intellectual disabilities from Stone Belt ARC, which is a disabilities advocacy and services center. We had 5 leadership all across from middle management all the way up to the top, together with working professionals from 9 local and state agencies who were serving humans across the lifespan. So this project really addressed toddler to elder. We had IU Pediatrics, IU Health Pediatrics, all the way up to Area 10 Agency on Aging. And so we had multiple key sectors of people involved, and I'll tell you about that in just a second. Today I am going to, there we go. I'm going to focus primarily on the evaluation tools that we use to engage in participatory social mapping, because these really helped us identify how risk factors for sexual violence manifest locally in public spaces, neighborhoods, and businesses. Because to increase these protections of social support and connectedness, it requires us to look at the environment and specifically at the determinants of health. And so because these determinants of health are where we want those protective environments to occur. And Linda from the CDC said these are settings that people move through. So I just want to have you be thinking about housing, transportation, neighborhoods, schools, jobs, and everything like that. And so the slide that I have up right now is really to sort of contextualize the problem, and I automatically assume that everybody on this call has a really great handle on the scope of the problem of sexual and intimate partner violence, but I cannot presume that you know about people with developmental or intellectual disabilities, so that's why I wanted to start there, because this information right here was really foundational to who I chose to recruit. The sexual violence prevalence rates for people with intellectual or developmental disabilities range from the low, if you can call it that, which we can't, of 65% prevalence to 98% prevalence of the entire population over the course of a lifetime. So our prevention strategies have to take that into account when we target people for recruitment. And I know that this is a busy slide, but the bottom image is a piece of data that I pulled from the CDC. They had this really great tool called the Community Health Status Indicators Map. They still have the data, but the tool's no longer available. But I needed this compelling data to convince people in a very resource-rich area in Indiana that there was a problem. I once heard that Bloomington, Indiana has the highest amount of nonprofits per capita of any town in Indiana, and I can't fight that. But needless to say, people really think that we're well-resourced, and they don't understand that it doesn't matter if the community is well-resourced if people are isolated. Well, of course it matters. That's ridiculous. It matters. But if people are isolated, they're not accessing those resources. And so I took this information to really show people in power that we actually score very low as compared to 30 other U.S. cities just like us. We are number 18 of 20 worst counties of this size for social support in the United States. So it was really important for me to be mindful of that when I was recruiting. So in terms of recruitment, it was really important for me to leave my comfort zone bubble of collaborators and work with people and agencies that I had never spoken to about sexual violence prevention and who quite possibly couldn't see their own connection to sexual violence at all. So what I did to recruit people is I actually started in the Disability Services Agency and asked people with disabilities, who would you like to work with? What are the kinds of agencies that you go to? What are some that you would like to go to? Where in Bloomington would you like to hang out? And then I went to leadership in the same agency and got the same kind of list. And from those 2 lists, I first initiated contact through email, then phone calls, and then if I was being really persistent and thought that they didn't have a choice and they needed to collaborate with me, I actually went in person with an executive summary. And I'm not intimidating, I don't think so. It wasn't like, you're going to do this. It was more like, hey, play with me kind of a thing. And so that ended up working really well, and the process is in the inclusion appendix, so people can take a look at that. And I actually meant to only bring 4 agencies together, but once it got rolling, people just joined up, and I finally actually had to stop it at 11, and I think probably that collaboration is a little bit too much for a project like this, but I wasn't going to say no. And so also I think it's really important to say here that through project recruitment, I was very interested to address and disrupt the social norm of power over. And especially for people with developmental and intellectual disabilities, the way that that manifests is through ableism usually, and racism, and often sexism. And so it was really important for me to make sure that the decision makers on the collaborative were people with intellectual or developmental disabilities. And so I knew that to create protective environments, I would also need to have people with decision-making power. So I sought out the city of Bloomington, and they were one of my first asks, and they actually did get on board when I showed them the data. And they were interested in mapping Bloomington too, so that really drew them. And another really key partner that emerged as a key to increasing connectedness for everybody in Bloomington were the 2 transportation corporations that I brought onto the project. And another agency was the public library, and then we had quite a few social service agencies across the lifespan. And so I really want to discuss with you, well, first I'll tell you, the partners were tasked to discover together what barriers were in Bloomington, Indiana to inclusion for people with disabilities. So we needed to do that through a bunch of formative assessment. So we created social network self-assessments. We had retrospective pre and post tests for the working professionals. We had focus groups with people with intellectual and developmental disabilities. We had key informant interviews with caregivers, particularly caregivers that did not work at Stone Belt. We felt it was very important to look outside the agency as well as within the agency. And we did participatory social mapping in tandem with Photovoice, and all of those tools and protocols are in the inclusion appendix. Participatory social mapping can really be done in a variety of ways. I think we gave you the top 3 tools that we used. But the bottom line of that is you're doing an environmental scan. So we definitely had to adapt the original protocol to meet people where they were at, because some people on the collaboration were really comfortable using maps as sort of an extraction of reality. But to be quite frank, most of the people on the collaborations just couldn't conceptualize a map in the same way, because some brains are different. And so people with developmental disabilities, sometimes it always helps to be very concrete. And so mapping was sort of an abstraction. We had to work through that. We also had to work through the fact that there were a lot of stakeholders who couldn't or didn't use their hands or arms to write, and there were a lot of people who were nonverbal. Quite a few people communicated through technology, and you can see on that picture Amy and Michael. And so for them, their excursion was much, much longer, because it takes Michael quite a long time to be able to communicate. But he communicates beautifully, but it increases the time. So we had 11 agencies in addition to 25 people with developmental disabilities, and every agency had 2 people. So that was a total of 47 people who got into teams, and they picked a location which was determined by people with disabilities. And this is just one of the pictures that we took. Once all the excursions were completed, we really needed a way to visualize the data. So Michael, in that picture, he created a geographic information system for us. And I will show you just a quick picture of that in a couple of slides. We spent 3 months doing social mapping. And Maggie Matson, she is a Master of Public Health. She was our public health consultant, and we took the outputs from all of those formative assessments, and we compiled together an 11-page single-spaced data, a document full of all the barriers to inclusion in Bloomington, Indiana. We used Photovoice to populate the Google map created by Michael, who I told you about that. And then we used these things to advocate to City Council and several commissions for sidewalk connectivity. Through the process, having all of that data, we did need to pare it down, and so we picked 3 goals. One that we knew would be attainable by the end of the grant, one that we knew would take quite a long time, and the other one was like, this is a pie in the sky, but we're going to do it. What I didn't realize before going out into the community with my stakeholders was that mobility and transportation were such key barriers. And in fact, these barriers are created in large part not really by the community, but by the way that people with disabilities can and are allowed to access support. It turns out Medicaid funding really dictates what a lot of people with disabilities who get services from day and residential programs can do in a given day. They have to choose 1 year in advance, essentially, what they want to do with their year. And if they don't select community engagement, then they couldn't be a stakeholder with me on this project. So that was a huge barrier. The maps and the video recordings were key. This Photovoice and the GIS map, and I did video interviews because of those transportation barriers. People, if they weren't going to a doctor's office or a job, then they couldn't use the Medicaid transportation to get to a meeting to advocate for themselves. So I was sort of a conduit in that way, using the data with their permission and guidance. And so the next slide here is really the bottom line. I think this is one of the things that I'm most proud of. Not only is this map amazing, but we set the goal to increase sidewalk connectivity near the Disability Services Agency that was the main stakeholder on this. And in 2016, we used that data to advocate to the City of Bloomington. And in 2017, the sidewalk is connected. And I know that the way that I wrote that makes it seem like it was really like bing, bang, boom, but it wasn't. We had to figure out together where we could take that data and how to use it to tell a compelling story. And so what we did was we reached out to anyone and everyone and got invited anywhere that the city was going to be. We went to city planning meetings, which really got us closer to figuring out what to do about needing to increase sidewalks. And through that process, we met tons of other community groups in Bloomington who were also advocating for sidewalk connectivity. And I think it's kind of fun that they got to learn that they were also they were doing sexual violence prevention. They had no idea. And so it was really kind of a skill building empowerment thing all around. And I want to say that learning how to advocate to the city for something that you need is a very different kind of skill building, I think, than the typical things that we think about when we read the Stop Sexual Violence technical package. I think a lot about classrooms and kind of recognizing warning signs for abuse and things like this. And so I was really excited that some of the skills that we were building were something that would potentially change things, change the environment. Let's see. I was also going to tell you or ask you to notice today and for the rest of the week the sidewalks, because I think that what you'll find is that the presence or absence of sidewalks can indicate health disparities. So there's one little spot that is not connected, and I don't know if we will be successful, and that's on the IU campus. And the Disability Services Agency is sort of, I think it's about 50 to 100 feet away from where students typically are. And in that little space, it goes from being beautifully tended with foliage and flowers and sidewalks to muddy, potholes. The sidewalk up there in the top right-hand side, there's just a random pole in the middle of the sidewalk, so people with wheelchairs can't even get through there, right behind their own disability services agency. So I just want to challenge people to go forth into their community and see the health disparities for them. And I wanted to actually share this other tool with you. This is another form of mapping that people can take directly to their agencies today. The Domestic Violence and Rape Crisis Shelter Middleway House developed this tool and used protocols to internally increase accessibility and inclusion in Middleway House, and the outcome was actually an environmental change that empowered parents and also reduced rules. The primary preventionist Evelyn Smith created safe and nurturing environments for parents and kids in a place that was really mapped to be difficult and punitive for residents who were waiting for case management. It would increase people's stress. It would, people said that it made them want to drink or use. And so I just really would recommend that people, though, kind of like what, there was a woman in the chat who was saying we need to use evaluation plans and implementation plans, and this is a case where I would say definitely track your changes. It's worth it. The library also was another agency that used a physical map to identify internal barriers, but what was kind of funny, actually I don't know, I'm feeling weird saying that it's funny, but the partners who mapped the library were blind. So the map tool wasn't used in the same way at the library as they really intended, but we did find out a lot of places that were quite dangerous for people who don't see, and so they fixed those, which was really great. So I'm getting close to the end. So finally, I wanted to ask us to think about those norms that enable sexual violence, the privacy, silence, and the power and the gender norms, and to think about why the project guide is called Sidewalks to Sexual Violence Prevention. And I just want you to look at that picture and imagine you're a person in a wheelchair or you're blind and you need to get to the bus stop that's across the street. And ask, what choices do you have? You can get muddy, you can get run over, or you can miss the bus. And all of those things contribute to stress. And more importantly, though, that it's roadways and sidewalk connectivity, or the lack of those, were the most prevalent barriers for people with disabilities on this collaboration. Stakeholders with disabilities were isolated without these things. So sidewalk connectivity may not immediately seem like a strategy to end sexual violence, but it really lets us think about these social norms. And sidewalks are passive. We don't have to think a lot about it. It allows us to safely traverse where we live, work, and play, and it also facilitates those other key connectivities like financial connectivity, medical and social, and that's really key to people who are vulnerable because we're talking about connecting people to their most basic needs, and all of those things confer power or decrease it. And the CDC tells us in Connecting the Dots that social connectedness is preventative of a lot of things, like I said. So at ICADV, we actually posit that abuse is a less easy option to use on someone who has a large social network, because connectedness broadens the social network so there are more people to check in with if you notice somebody is having a hard time, or call them out when people are getting it wrong. And these actions actually address those social norms of privacy and silence that allow for sexual violence to continue. So I think the broader the network, the more social support that is there and available, and giving people the skills to know how to use them, those things indicate more inclusive spaces and places and people. And sidewalks literally facilitate access to physical and emotional connectedness. So I just have to ask, why not sidewalks? And so I'll just be really, really, really brief because I know I've been talking a lot. The lessons learned here reflect what Linda said too. Relationship building is so, so, so important. And my grant parent is in the crowd, so I'll be very nice here, but I do want to say that the way that the RPE is set up in Indiana is that usually there is a application process from year to year. And so when you're looking to modify the environment, like Linda Wilkes said, it can't happen fast. And again, transportation was a huge barrier, so I've learned, and for the last 2 grant cycles, I've written in and budgeted for transportation for people with disabilities. Inward-facing changes were really, really important for all participating agencies, and that wasn't emphasized very much in the first year. So we really started paying attention to those internal things around cultural, like, what is the word? I wanted people to understand how to work with people with disabilities. I also didn't really collect a lot of data from neurotypical people, and I kind of regret that. I wish that I had the working professionals also do the mapping process. They were partnering with people with disabilities, and people with disabilities were doing the mapping, and now I wish that I had more data, even though I said we had 11 pages. And then really the tortoise wins this race. We had 2 assaults and a suicide in the first year of this project, and I had to do a lot of expectations management on myself and others just to not get really sad and not want to stop working on this, because we know that culture change takes forever. And thank you so much. I'll turn it back over to you.
Thank you so much, Sarah. We have a couple things for you.
Okay.
So there was a question from the audience from Carrie asking about the community health status indicators map that you mentioned.
Mm-hmm.
I don't know if there's a link that you could put
Absolutely.
in the chat. That would be great. Thank you.
No problem.
I mean, every time I hear you talk about this work, the passion that you have for it is just
Thank you.
so obvious. Yeah. And I think
I want people to call me. Call me, people. Sorry, Ashley.
Well, that's
dorking
nice
out.
that you offer that. But I think it's such an important point that you made, that we don't often think about something like sidewalk connectivity as sexual violence prevention work. But as you broke it down, when we start to think about all the ways the lack of accessibility and mobility impact people's lives, it becomes really clear. The other thing that I thought was really important is when you pointed out how there were already existing mechanisms and groups through the city that you were able to connect with to advocate for the changes that you all are interested in making. So you didn't have to, you were able to connect with people, and push some of that through. That's great to hear.
Yes. Actually, there was a split off from the collaboration that became the Monroe County Coalition on Accessibility and Transportation, and the stakeholders with disabilities are a part of that coalition now, and they're changing bus routes with an entire coalition of people that of those humans that we came into contact with, that turns out that we were all interested in the same thing. They just didn't know that it was sexual violence prevention, and now people are talking a lot about sidewalks in Bloomington, and it's wonderful.
That's great. Thank you again.
You're welcome.
So another question for you all is, how else are you addressing community risk factors? So what other strategies are you engaged in that can complement work to change the physical environment? We'd love to get some of your thinking around that and some examples. And at the same time, as you think about that, I am really excited to introduce you to our final presenter for this web conference, or this peer learning forum, Melanie Austin from the Metropolitan Organization to Counter Sexual Assault, also known as MOCSA, in Kansas. And Melanie, so this is an RPE program. And Melanie, it would be great if you would walk us through the work that you all are engaged in terms of preventing sexual violence at the community level. So let me give you the podium, and now you should be able to advance your slides.
Thank you. Hi, everybody. I'm really happy to be sharing with you today some of the community level work that we're doing. I'll kind of start off, just give you a general overview. We're working in Wyandotte County, Kansas. And just a little bit of history about that county. It's really one of the most diverse counties in the country. I think it's like second to a county in Florida. So it's got a very diverse population. The largest city in the county, Kansas City, Kansas, is really the majority of the population in the county as well. There's a few other smaller cities as well that have some small populations as well. The county has been consistently at the bottom of the state health rankings. So they've been, 101 out of 101, or, so for the last, I don't even know exactly how many years, but probably like at least 5 or 6 years, they've had consistently poor health rankings. There's also kind of a stigma around Wyandotte County here in the metropolitan area, like, oh, you're from Wyandotte County, there's a lot of crime there, very low resource, poor health. So kind of a stigma associated with the county. And then the other interesting thing is that just south of Wyandotte County is another county called Johnson County. And that county is very well resourced, always at the top of the health rankings. So it's just kind of really interesting that you have these two counties right next to each other, but have very different, very different health rankings and economic statuses and whatnot. So just a little history about the county. I think that'll give some context to what we're doing. So I'm just going to go over, I guess, kind of where we started. We started with building a coalition. So the coalition has kind of been together since about 2004 and focused on individual education for sexual violence prevention. In about 2014, we switched our focus to doing community-level prevention work, and community-level primary prevention work, I should say. Part of the reason for that shift is just recognizing that education is so important, and the individual work is really important, but that if we want to start seeing, I think, greater impact and change in our field, that we need to be doing policy change, environmental change, and things that we've seen, other, other groups or whatnot do. And so, and also we want to have a bigger impact. And so when we pulled our coalition together, we kind of came up with our mission, and that is to, have a county that is free from sexual violence. And so then we pulled together, we had some, kept some of our same coalition members, but we also did recruiting of new coalition members. And so we have multiple sectors represented: our school district, law enforcement, our health department, we have a community health council, our university, another group called Livable Neighborhoods. So we have faith-based, so we have a variety of different sectors represented on the coalition. And kind of how we built buy-in is talking about the shared risk and protective factors for multiple forms of violence, and how all of those risk and protective factors can affect and are important to these different organizations that we're working in. And so that kind of helped us build some of the buy-in for getting people to join. And the coalition meets monthly to work on our projects. So one of the first things that we did was a needs assessment in our community. It consisted of a survey, focus groups, key informant interviews, and we just kind of learned a lot about how people felt about sexual violence in the county, but then also kind of that people recognized that the community had a role in preventing sexual violence, but they really had a sense of hopelessness in how to do that. And so from those needs assessment findings, we decided to do some action planning. And so we got that information from residents and people working in the community, and we're like, okay, what are we going to do with this information? And so we did some brainstorming, and we had come up with that we wanted to work on community support and connectedness, because we thought that was a really positive factor to work on, especially given some of the stigma in the county itself already. And then we also identified that we wanted to work on something called crime prevention through environmental design as a strategy, also called CEPTED. And after we kind of decided that we were looking at community connectedness, looking at utilizing CEPTED, we were like, well, we need to know what people are really willing to do when it comes to changing the built environment. And so the next step that we did is we did a community readiness assessment, and that was a really not as on the same scale as the needs assessment that we did. But this readiness assessment just really helped us determine like what are community members really willing to do to address environmental factors that lead to violence. I also wanted to take just a step back, and I forgot to mention, because of those poor health rankings, there's a lot of organizations and government entities that are working to improve health outcomes. And so another way that we recruited in getting people interested in looking at sexual violence prevention on a community level was just connecting it to health outcomes. And especially like things like how, you know, it can be connected to things like chronic disease and that kind of stuff. So there's already a lot of energy in the area around improving health and safety in the community. And so working on SEPTED in the coalition with the community was kind of a natural fit. So we did this community readiness assessment. What you see here is an infographic that we had made. It's been identified that there's a lot of survey fatigue in Wyandotte County because there's a lot of people, like I said, doing a lot of different initiatives. And so residents were just kind of feeling frustrated that, hey, you're surveying me, but I don't know what the results of that survey. You know, no one shares the results with us. We don't know what's happening with that. You know, we're kind of tired of taking these surveys and not seeing anything happen. And so we were very intentional about trying to create, you know, a piece that we could communicate with people. You know, here's what the results said. Here's, you know, some things that you can do to help keep your neighborhood safe. And when we worked on sharing that with like neighborhood groups and people that we had given the survey to. So like I said, we were really intentional about that. I think that's really important when doing this work. So as I mentioned, we are working on SEPTED, and what we're doing with that is we're working with community or organizations that are doing environmental change work in the community, and we are kind of giving them some education on SEPTED principles and then working with them to adopt those principles into the work that they're doing in the environment. So far we're kind of, I call it like piloting because it's kind of the first time we've been doing this, but we're working with a community development agency that's it's part of a church, but it's their community development arm. And so we're working with that group, and we've done help them with some work that they've done in parks around in their area and utilizing SEPTED principles. And then we're also going to be working with a group that is it's called 20-20-20, and it's basically they're trying to improve sidewalks, paths, and that kind of infrastructure in the area. And one of the things that they want to work on is called Safe Routes to Parks. And so we're going to be working with them to include SEPTED principles while they're looking at how to create safer routes to parks in the area. And so that is really exciting. We've been kind of working with them for a little while, but we're just kind of formalizing our relationship there and moving forward with that. So the other thing that the coalition is working on besides SEPTED is a violence prevention plan. So this is a violence prevention plan for the whole city, for the whole county. And we determined through some community meetings that we had, also through our needs assessment and readiness assessment that we did, that there was a need for the community to have a violence prevention plan. And so the coalition also started working on this, and we're super excited about it. The goals and objectives come from our needs assessment and our readiness assessment. We also held a series of community dialogues where we got input and feedback from residents and in different geographic locations around the county. And so we determined 3 major goals for our violence prevention plan: to foster safer, violence-free neighborhoods, promote and support community connectedness, and then address cultural norms that support and promote violence. So one of the really awesome things I'm so excited about is that we are actually going to incorporate this violence prevention plan into our health department's community health improvement plan, or their CHIP plan. We had been looking at ways to get this plan adopted by the county where is it going to sit, who's going to manage it, what goals are going to go, what strategies are going to go underneath it. And so through all of the work we've been doing and the networking and the building relationships and talking with people and pulling together a group to help draft this plan, we've identified that it will be part of the CHIP plan for the health department. And that's really exciting. I think it's just an example, I think, of a huge, organizational change and, even a policy or plan change for the county. So this plan will also include STEP-TED work, or STEP-TED as a strategy underneath the fostering violence-free neighborhoods. So I didn't put all of our objectives underneath the goals, but it will include that as well, which is really exciting. So I think my favorite thing to talk about then will be some of the, lessons learned during this whole process. I haven't really talked about evaluation yet. I think it's one of the things that's been a little bit challenging for us because how do you evaluate some of this community level work that takes time? And fortunately, we do have an evaluator that we're working with, and I'll talk about that as a key resource here in a second. But some of the challenges that we have are that community level work takes time. Building trust and credibility takes time. We're working in a community where lots of people start up projects and lose their funding and then they stop doing the project. So we had to work on building trust and, letting people know, like, we're here. We're not leaving. Should we lose funding or anything like that? Like, we are committed to doing this prevention work here. And I think that's gone a long way. And the other thing is that working in a coalition, you are getting commitment from other community members, community organizations, government groups. And so when it's a collaboration, I think that also shows, like, yeah, we're a group and we're here to stay. We're working together on it. We really struggled in the beginning helping people to understand the difference between community level prevention versus individual level. A lot of times people really struggled and wanted to fall back on that kind of like when we were brainstorming ideas, they wanted to do education. And education, like I said, is so important, but they really struggled with kind of what the difference was. And so we're really at a point after maybe 3 years of doing just consistent education on the difference between them that people are kind of like, yeah, we get it now. And I think this is not just within our community, but also in my own organization, talking about, well, when we specialize in doing sexual violence prevention education from kids to adults, it's really different to be doing community level work and talking about how shared risk and protective factors are also a way to address preventing sexual violence. So there's also that education that we had to do even within my organization. Also, I think there's not really a clear roadmap for success, and so that's kind of scary sometimes when you don't have that. I think that's another challenge. Some opportunities that we've had, I think we've had increased opportunities for violence prevention work in the city. So one of my colleagues or community partners got a big violence prevention grant for youth, and so that's just really exciting. And it's over a 5-year period, and there's going to be some really cool things happening in that grant. And so that grant opportunity, which also has several of our coalition partners working on that, I think we were able to come together quickly for that because we had this connection already in the coalition and because we were already working on violence prevention. Also some unique partners. I think a rape crisis center is already kind of a unique partner when you're talking about environmental change work. But like I said, we're working with like a livable neighborhoods group. We're working with our community health council, with our health department. These are all folks that we haven't really worked with before that much. So some really interesting, unique partnerships have been formed. Like I mentioned, we have our violence prevention plan is going to be in the community health improvement plan. That's a 5-year plan for the health department. So we know it's here to stay. We know we're going to see some change, and it's going to be change that we can measure. So that's exciting. And I think just the opportunity to leverage the resources that we all have together to have a greater impact is also a really exciting opportunity. I think some really great resources that we've had available to us, some of us on the coalition have done SEPTED training. We're also going to do a SEPTED training coming up in January for a lot of our coalition partners and people who have influence in the city on our environmental change work. We've done some meeting facilitation training called TOPS, and that's been really helpful because if you can imagine facilitating a coalition, you have a lot of meetings, and so you want people to feel engaged, like they're not just at a meeting for a meeting, but that the work that they're doing is meaningful for them, their agency, their community, and the work that we're doing. We've done a couple of reverse site visits, so we've had the opportunity recently to go up to Minneapolis to visit their health department and learn about the violence prevention plan that they have. They're 8 years into their process, and they have really seen a reduction in youth violence, specifically youth homicide. So that's really, it was exciting to hear what their process looked like and the success they've seen in the 8 years since their plan's been implemented. We've also done phone calls with researchers who've done SEPTED related research. And then we work with an evaluator, which is really awesome. She helped us with our needs assessments and readiness assessment, and then she also helped us, and is in the process of helping us determine what kind of indicators and measurements do we need to measure things like community support and connectedness, to measure change when it comes to our work with crime prevention through environmental design. She's really been a great asset to us. Yeah, I think that's all that I have to share today. Oh, the last thing I want to say, sorry, I just forgot. We have been using the public health approach to come up with this program, So it's just a way to, determine what our need is, what shared risk and protective factors are we looking at. Now we're kind of in the testing and development stage. And I think, once we can figure out, with our violence prevention plan and our SEPTED program, once we determine what the best fit is, and we can start sharing all of that more widely with other people. So thanks so much, and I hope you found this helpful.
Thanks, Melanie. So Sierra actually has a question for you regarding working with the folks on CHIP and how they received your partnership as a rape crisis center. And so Sierra said, did they embrace you with open arms, or were they of the mindset that sexual violence doesn't happen here or isn't a public health issue?
Well, I will tell you, our needs assessment had a lot of othering, which is kind of the idea well, that happens to other people, that doesn't really happen here. So the community kind of has that response, but as we've been working with our community partners, we have been pushing to, so for their CHIP plan, they did a community health assessment, and because we had already had the health department on our coalition and were invited to the table for that planning the community health assessment, we asked them to put in questions about violence. And so we actually didn't, which is good. So they were measuring that as part of their community health assessment. But it was actually the community that said violence is an issue here, and it's a top issue here. And so it was through that community health assessment that they determined it was one of the top issues. And that's why they decided to include violence. Now, because the health department had been sitting on our coalition and knew that we were working on this violence prevention plan that included multiple forms of violence and working on shared risk and protective factors and sexual violence, it was kind of a natural fit. They were actually really excited to have our coalition that was meeting to draft this plan to move this plan into the CHIP process. So, and there was discussion with the coalition too, is this the right step? Is this the way that we want the plan to go? And it just made sense overall. So I'm not sure if I answered your question, but
I think you did. Sierra says that is glorious news.
Yeah, I was just so excited. I think that's another challenge, is just measuring those things, kind of the anecdotal things. That it's a really big change, but how do you measure that in preventing sexual violence? So that's something we're still kind of looking at.
Great, thank you. I also think your point of how do you move folks from this very like individual level mindset to the community level, to thinking more about community level strategies. And I'm wondering if you have any tips for helping people shift their thinking in that way.
Yeah, honestly, what's really, first of all, I always start off with individual education is an important piece. You know, it's just an important piece of the prevention process. So I always start off there when I'm also then trying to educate someone about what community level or societal level work looks like. And so really from what we did, and I'd be happy to share it, but we did just like a mini PowerPoint on public health concepts and just talked about the difference between, you know, kind of shared the social ecological model and then talked about the difference between first, second, and third prevention, or primary prevention versus like tertiary prevention. And really that's all we did. And we talked about, and we had to repeat ourselves quite a bit actually with a lot of people. But, you know, and if people who've done coalition work, you know, sometimes you have different people in and out of meetings. And so that's part of the reason why we were kind of just having to say, and remember, this is what community level work is, and this is what we mean by primary prevention at the community level. This is an example of individual education. So,
thank you so much, Melanie. It's so great to hear this really exciting work happening in Kansas. So thank you. So we'd love to hear from you all about how you'd like to see this conversation continue. And so feel free to let us know now in the chat box, or we will be sending an evaluation survey in a few minutes, and so you can also take some time to think about that and let us know in that. But we'd love to hear from you. Was this helpful? What else would you like to see? We really hope that these examples that our awesome presenters have shared today have inspired your thinking about community level strategies in your work. And if you know of other examples, or if there are other aspects you'd like to explore further, we'd love to hear from you about that and see how we can continue to move this conversation forward. And yes, Judy, hi Judy, I will be making a separate document with all of the resources that have come up in the chat, and I will include a link to where you can get that. It'll be on the same page that the slides are on, but I'll include that link in a follow-up email that I send within a week that will also have the recording of this. So for those of you who are Tiffany, more examples like this, also examples of how people have evaluated community level efforts. Yes, that is super important. So thanks for your feedback, Tiffany. So I just want to say, and I'm going to leave the text chat box open, so feel free to continue to provide your feedback on that. But I just want to thank you all so much. I want to thank our presenters today. Linda Dahlberg, thank you so much. Linda Wilk, thank you. Sierra, Melanie, thank you all so much for taking time out of your day to share this information and provide these really wonderful examples. And thank you all for joining us today. I hope this has been useful. Like I said, I will leave the text chat open, so it seems like there are all some stuff, or there's some more conversation going on. I'm losing my words if you couldn't tell. But thanks again for joining us. We will get all of this information out to you within about a week. And if you need anything in the meantime, you are welcome to email me. Otherwise, I hope you all have a wonderful rest of your Thursday, and we will see you soon. This concludes our Peer Learning Forum for today. Take care.